I've been specializing in the medical and surgical treatments for scalp hair loss for over 25 years. I am board certified or a diplomat of the American Board of Hair Restoration Surgery. I'm also a past president of the International Society of Hair Restoration Surgery, currently on the board of that society and chair of the Continuing Medical Education Committee for the ISHRS. In my practice, I'm always looking for new treatments for men and women that suffer from scalp hair loss. There's surgical treatment, there's medical and topical oral treatments for men suffering from male pattern hair loss. And for women, it's been more difficult to treat because of the nature of thinning in women, so looking for new treatments has always been a challenge for my practice. Low-level light lasers have been on the market for about 10 to 12 years. The original lasers were handheld laser brushes or combs, which had anywhere from 8 to 12 laser light diodes and emitted anywhere from 10 to 60 milliwatts of power. However, it was rather cumbersome and needed to be used manually every day or every second day. And then laser bonnets or panels were developed where you would go to a physician or technician's office and sit under this bonnet for 30 minutes to an hour every day or every second day. However, the bonnet didn't really touch the scalp and was a little bit elevated from actually getting to the root of the hair follicle. I was intrigued when I heard about the laser cap. I was asked to be an investigator for the company, and I accepted because that way I was able to see firsthand how well the laser cap actually worked. The laser cap has 224 laser light diodes emitting 1120 milliwatts of output power. It was a more attractive device because the laser is actually in a cap or hat, so it's more discreet. It can be worn at home. It has a battery pack, so you're not confined to one position. And it's to be used every second day for 30 to 60 minutes. So I was intrigued by how it worked. And in terms of its efficacy, I think that any kind of laser really isn't going to work very well on a male patient who's been bald for 20 years. However, where lasers I think will have an application is in men who have had established hair loss, have gradual thinning, and the laser in many patients can help to make the hair grow fuller, faster, and thicker. And where I think it has an even more of an impact would be on females. Females who have a different sort of thinning compared to men, where they maintain the front hairline and don't have the total balding that men have hair that can be worked on by the low-level light laser power. And so I think the laser cap has many applications for females. In men as well, low-level light lasers like the laser cap can be used as an adjunct to other topical and oral treatments. And in females as well, I think the laser cap is going to be very helpful for many women.